record me now. Okay, while I'm outside Mr. Slade's room, I'm going to be gathering up my supplies for the dressing. I looked at the dressing. I know he's got 4x4s. I've looked at his chart. I've looked to see what he's allergic to. Some patients are allergic to betadine. Some patients are allergic to plastic tape. Sometimes you have to be very careful what kind of cleaning agent you use and what kind of tape you use. If he was allergic to something that the doctor had ordered to use, of course we would call the doctor and say, we need an order change. We would use, what would we use? Aspar. We're also going to check the chart to see what exactly kind of dressing. A lot of doctors order very specific dressing changes for their patients. A lot of doctors have kind of like standing orders that you do the same kind of dressing on all their patients. You're also going to check to see if it's a wet to dry dressing, or if it needs a culture, or if it's just a dry dressing. Then you're going to gather up the equipment that you need and come back to the patient's room when you said you're going to, which is going to be 30 minutes later. So we're heading back in right now to Mr. Slade's room. Hello, Mr. Slade, I'm back. It's been about 30 minutes, really close. So we're going to do your dressing now. Let me get my hands clean. You doing okay? Pain pill working? That is great. I'm going to pull your curtain, provide for privacy, shut your door, and we're going to get to work. Smells good. So I'm going to, forgot my garbage bag. Set up my trash bag. Usually this would be a red bag in your patient's room, but I couldn't find one, so it's a trash bag for now. Tap it on your patient's bed. Go ahead and elevate the bed. All right, you've had this dressing change before, right? So you remember what we do. We're going to just have you lay right still, and we'll try to be as painless as possible, I hope, Mr. Slade. I'm just going to uncover as much or as little as I need to show that incision or to show that dressing. We'll hold the tape, hold the skin while you pull the tape. Push the skin back while you pull the tape up. Causes less tissue trauma. Once you've loosened the tape all around, like I said, keep your hands on the skin and the tape at the same time. You want to try to take the dressing off away from the view of the patient. You can take it off a piece at a time, or sometimes it's just easier just to take it off all at once. Now, first thing you're going to do is look at this dressing. See what kind of drainage it has on it. Make sure it's all intact. This has red drainage. Bright red drainage indicates some little bit of active bleeding sometime since the dressing was changed last. Red drainage is called sanguinous. S-A-N-G-U-I-N-E-O-U-S. Sanguinous drainage. So now you're going to take this, wrap it up in your glove if it's not too cumbersome. Take your gloves off. Throw all that in your dirty bag. Wash your hands, and you're going to assess your incision. What you're looking for in your incision, since this is just a closed incision, surgical incision, you want to look to see what it's closed with. These, we're going to call these clips or staples because they're so straight. They might also be closed with sutures. A lot of doctors nowadays are just closing with glue, like adhesive dressing. You might just have Steri-strips on it. So that's a big part of your assessment. What is closing the wound? Also, is it approximated? Approximated means the two edges are close together as they're supposed to be. So you can see this is well approximated. The clips are intact. You're also going to look as you're assessing the drainage, the incision. Is there any swelling? Is there any active drainage going on? Is there any bruising? Sometimes they'll have little bits of bruising here or in the midline incision. Distal incision, of course, will be down here. Proximal incision, of course, will be up here. So you're not going to put your hands all over it like I am, but I was just trying to show you. Okay. All right. So now you're going to set up your sterile field. Like I said, you would not put your hands on it like I just did. That was just for an example to show you what to look for. After we take this dressing off, we're not touching any of this. Now we're going to set up our sterile field. Now we're going to, the last thing we're going to use to cover the wound is going to be the first thing we're going to open. And hopefully that will make sense to me to you in a minute. Sterile gloves, tape. We're going to use tape last. We're going to use gauze sponges first. We're going to use those to actually clean the wound. We're going to use gauze sponges for covers. And then we're going to cover the whole dressing with this. So this is what we're going to use last. These two, and then these two. So this is how I want you to place them on your table. Put your table beside you where you can still see it. And then when you start opening your packages, you want to start also with what you're going to use last. You want to open it first. Thank you. The 1-inch border of these packages is considered dirty. So you can put your dirty fingers on the 1-inch outside. Everything on the inside is considered sterile. Okay? So when you open these, there we go. It's okay to touch that 1 inch. It is not okay to touch any of the rest. Everything in here is sterile. Okay? So if you needed to use this side to put something sterile on, you could. I'll show you what I mean, hopefully, in a minute. That one's not going to work. And actually, yeah, go for it. Come on, dressing. Now, while still looking at your sterile field, this should be in your sight at all times. You're going to wet some of your gauze to do the cleaning with. So you're going to lip your bottle. That keeps it sterile. Now, everything here is still sterile. You do not want to do what I almost did just then. You don't want to wave your hands over it because you're going to contaminate everything and have to start all over. This is sterile. This is all sterile. This is going to be a sterile dressing change. So we're going to don sterile gloves. This can go, actually it can go in there. It's okay to lay these on your patient. If you have room on your table, you can lay them on your table as well. Unfold the top, unfold the bottom, and snap it. I want you to snap it in the middle. See what I mean by snap it? Snap it in the middle. Whether you don't have to tear it, but snap it. Because if you don't, those things are going to start folding back in on you. You take the cuff of your dominant hand, and you pick it up by your non-dominant hand. Everything on the outside of your glove needs to remain sterile, okay? You see how nothing on the outside of my glove touched my hand? So this is sterile. This is sterile for now. So we can reach into the cuff of this one and hold it up like this. That's still sterile to sterile until I get my nasty hand in there, which my hands are clean, but you know what I mean. Always keep your hands up when you're putting on your gloves. Snap them on. Okay? So this is all sterile. This is all sterile. So we're going to clean. Pick our gauze up. Pick out any excess fluid. Always keep your hands above your waist when you've already donned your sterile gloves. My table's not as high as it should be, so I apologize. Sterile to sterile. We're going to clean the wound. Always cleaning the wound from the cleanest to the dirtiest. The cleanest part of a surgical incision is the incision itself, of course, because it was done in surgery under sterile, whatever, procedure. Straight down the middle. Down. Far side. Don't touch that sheet with your hand. Closest to you. Let that dry. Please note, this is very important. You see where my sterile glove package is? Right there. Leave it. Once you get those sterile gloves on, just leave it. See where these package empty ones are? Leave them. Most people make a mistake by, they'll put their sterile gloves on, they'll be all sterile and want to pick up their package by the outside. There you've automatically contaminated yourself. Leave the garbage until you're done. Pick up a 4x4. We're going to use this to cover the wound. Unfold it. Fold it lengthwise. Lay it on top. Same with this one. Unfold it. Fold it lengthwise. Lay it the opposite on top. Get your ABD pad. Pick them up by the middle. If I didn't say before, pick them up by the middle. You don't want to contaminate your sterile gloves by touching the 1-inch outside package. We can place that right over top of that. Our wound is now covered, so it's okay if I move some of this stuff out of the way. Okay, we're covered. We'll take our tape. Normally, I would cut my tape with scissors just because it looks so much nicer, but I didn't bring the scissors at this time, and I know that's a no-no. I'll have them for the next one. And every time you change a dressing, you're going to put the date, the time, and your initials. That way, if somebody comes in 15 minutes and this is saturated with blood, they're going to get a better idea. They're going to get a pretty good idea that this is having some active bleeding. If it's 4 hours later, it's not going to be as much of an alarm to you. Of course, cover your patient back up. Mr. Slade, is that okay? You feel all right? You know, we'll do it again tomorrow or later on if we need to. Put all your stuff in the garbage bag. Reposition him for comfort. Lower the bed. And chart. What you want to chart exactly. And you will get examples in class. Midline abdominal dressing removed. Moderate amount of sanguineous drainage on dressing. No, incision well approximated, clips intact, no active drainage, redness, swelling, ecchymosis noted. Incision cleaned with normal saline, dry sterile dressing applied, sterile technique used. Patient did not complain of pain during procedure. Your name, Nurse Robinson. The end.